So we're going to look at dry and wet needling. Please look at the disclaimer below and only continue if you are qualified to do this. The muscle itself is very deep. Running just below it or very close to it are the popliteal blood vessels and nerve. So you need to be careful when you needle in this area. The one little trick you can do is feel for the popliteal artery, which is running down the middle and is very close to where this trigger point is. So feel for the popliteal artery. This is only palpable in a proportion of people, especially if you've got someone really thin, it's easier to feel. If you've got someone with a big, either plump or muscular leg, it can be quite difficult to palpate the popliteal artery. So prior to needling, you need to explain to your patient that if he or she feels an electric shock shooting right down the back of their foot, that means that you've struck the nerve, and they need to know that that may happen. If your needling is very slow, it's not going to be a major issue and you won't damage anything. So you're just feeling very carefully with the tip of your needle. Find the trigger point, apply, clean it with a little alcohol swab, put your introducer over, give a quick tap. Now that you're through the skin, you slowly move the needle down until you either have needle grasp or you feel a little jump, a little twitch. This is a deep muscle, it's unlikely you will. Or he feels a little electric shock or an ache. Once you're there, you leave it, maybe give a slight little twist and leave it for 10 minutes. Take the needle out. Then I always follow with heat and a stretch as I've just described.